Experiencing a mental health crisis is alive today after this moment when singer Jon Bon Jovi persuaded her to not jump from a bridge in Nashville. All of it you can see caught on security video. The woman was already on the other side of the railing when Bon Jovi was in the middle of a photo shoot on the bridge Tuesday. He and another person walked up to her, spoke to her for a bit, and were able to convince her to come back on the other side of the railing to safety.
And through Bon Jovi's Soul Foundation, he has training in how to talk to people dealing with a mental health crisis. Joining us live now, the executive director of NAMI New Hampshire, Susan Stearns. It's a pleasure to talk to you about a very important topic here. As it relates to Jon Bon Jovi, the bridge incident, right place, right time, certainly. But a mental health crisis can pop up around you at any time in any place. So if you are a layperson watching this unfold, what are the first few things that you should do to try to help?
Well, first and foremost, we all do have a role to play here, just as Jon Bon Jovi showed us. We need to care for each other. And when we see someone in distress, we need to act. Folks most often may find that they have someone in their lives, a loved one, a colleague, or a friend that they're concerned about. And one should never hesitate to ask difficult questions, or perhaps better said, awkward questions. Are you okay? And can I help?
And now, Susan, in terms of this particular incident, the reporting came in that Bon Jovi had gone through some kind of training to deal with this kind of incident specifically. What kind of training is out there for folks, and whether or not they have that training, what can you do to make sure somebody gets the help they need?
So there are a lot of opportunities for training. NAMI New Hampshire offers it through our Connect Suicide Prevention program. A lot of our partners in the state offer suicide prevention training as well, particularly around youth suicide prevention. Connors Climb over in the Seacoast does great work. There's so many folks doing this work in our state. Folks can check out the New Hampshire Suicide Prevention Council's website to learn more as well. But you make a good point. Not everyone is going to necessarily be trained in how to respond. But we all can avail ourselves of resources that are available 24/7, like the 988 Mental Health and Crisis Line, and also New Hampshire's Rapid Response, which are available for you to give to someone to call, but for you also to call if you are concerned about someone.
Certainly,
And
Susan,
truly,
too.
Ask the question.
And it might not be someone on the edge of a bridge, literally. It might be you're noticing changes in somebody. You're noticing a decline in their happiness or their joy, or they're restless, or they're out of their norm. So what are the most valuable ways we can intervene at a time before we get to somebody on the edge of a bridge?
First and foremost, if you're really concerned about someone, don't leave them alone until you know they're connected with help. You're right, there are a lot of different warning signs before someone necessarily gets on that edge of a bridge. And they can be overt, where someone says they don't want to live anymore. They can also be things where someone might say, you'd be better off without me. There are also signs where someone may be more irritable. They may indeed seem to have lost hope. They may be giving away treasured possessions. The reality is we need to always be checking in and remind ourselves that any one of us could find ourselves in this place where we are feeling hopeless and where we really need someone else to help us and reach out, help us hold on to hope, and help us get connected with resources. With 988, 3-digit number, we all know where to call, and we need to share that information widely so that the reality is you may ask that awkward question and hear something that indeed someone is considering suicide. You actually do have a resource right there with your phone. Make that call, stay with that person, and if you're really concerned as well and they're willing, you could take them to an emergency department if you feel that they are at that level of risk. And 911 remains a resource always if there's significant danger to you or someone else.
Yeah, and Susan,
so we do have resources.
Exactly, and as we've talked about before, on this air, there are people who they get to the other side of this and they see that that incident a whole lot differently, and they come out with a new perspective, and We've talked about those numbers significantly. We appreciate your time today, Susan Stearns, Executive Director of NAMI New Hampshire. And want to remind viewers that help is always out there, like Susan was just talking about. If you or someone you know is dealing with a mental health crisis, you can call or text the National Crisis Lifeline at 988.